morning. My name is Victoria, and I'm gonna be your nurse practitioner today. I'm gonna examine you from head to toe. What is your name?
My name is Kate
And last name?
Meckler,
Date of birth?
July 13, 71,
How you identify yourself today?
as she.
I will ask you a couple questions about what did you eat in the morning today?
For my breakfast, 2 eggs and tea.
And was your birthday last year? Where you celebrated?
Just home with my kids.
Okay, perfect. So I'm gonna start from head and proceed to so her memory, remote and immediate memory is intact. She is alert and real. I'm gonna proceed and check her stethoscope, and I'm gonna proceed and check the head. I have to wash my hands. Sorry. I wash my hands. Okay, I'm checking the skull. Skull is no tenderness, no deviation. Hair distribution is normal. Face is symmetrical, eyes symmetrical, ears symmetrical. Brow distribution is normal. Eyelashes is normal. Face is not swollen, and I'm gonna check your. I'm gonna put the glass. I'm gonna check your eyes. Can you just look up and look down? And conjunctiva, palpebral, and bulbar is clear, and sclera is white. I'm gonna check frontal sinuses, no tenderness, right? No pain. And I'm gonna check temporal arteries. Is normal pulsation, 2+. And I'm gonna check vision first. And can you just close your one eye, please, and look at this and tell me the lowest. And we're checking
CFDHJ.
Okay, it's 20 to 20. And another one, please.
EFTZO.
Okay, 22. Perfect. And we just check cranial nerve number 2. And I'm gonna ask you to smell something. So I'm just gonna. Can you close your eye? Close your nose. What's that?
Coffee.
Perfect. And now abstract your nostril. What is that?
Spicy. Chai spicy.
Okay.
Alcohol. No.
Okay, perfect. Okay. So we just check cranial nerve number 1, and I'm gonna check. Check cranial nerve number 5, trigeminal. So close your eyes, and do you feel?
Soft.
And just tell me if you feel.
Yeah, I feel.
Do you feel?
Mm-hmm.
Okay, and now open your eyes and just chew. Yeah, perfect. And we'll just check sensorial and motor division of number 5. And now I'm gonna ask you open your eyes against my resistance. Just close your eyes against my resistance. Perfect. And show your teeth. Okay, perfect. And now I'm gonna look in. I'm gonna check your eye. Look inside of your eye and check consensual and direct reaction for the light. And perfect. And iris is constrict. Okay, and consensual and opposite iris is constrict. And we go in, and I'm gonna turn off the light, and we're gonna check. I'm gonna look inside of your eye, I'm going to turn off the light. And we're following the red light. And I'm going to look inside of the eye. Perfect. And I'm following the red eye. The red light. Look inside of the eye. Perfect. And so the findings are normal. Disc is sharp, no avinikin, no edema, and macula is observed. And now I'm gonna press inside of the. So we're just looking if lacrimal duct is functioning normally and no discharge, no pleural discharge. And we're going and checking her ears. And I'm gonna check cranial nerve number 8. And I'm gonna obstruct your ear and tell something.
Apple. Basketball.
Perfect. And that's cranial number 8. And now I'm gonna ask you, can you shrug your shoulder again? My resistance shrug. And my against resistance, just yeah, perfect. And I just check cranial nerve 11. And can you just show me your tongue and move from side to side? And this is cranial nerve number 12. And I'm gonna go inside her mouth and check and open. And I'm just checking. Can you say ah? Okay, perfect. And cranial nerve number 9 and 10, vagus nerve is intact, and uvula midline. So now I'm gonna go and check her nose, and I'm gonna look inside of the nose. I'm gonna palpate the nose and no tenderness, and I'm going inside and looking one nostril, another nostril. So it's no polyps, and septum is midline and no discharge, and membrane is pink. And I'm going to check her ears, and at first I'm checking her, checking the mastoid process and checking outside the ear, pressing on tragus, no pain, no tenderness, and no rashes. And now I'm going to look inside of the ear. So I'm gonna look inside of your ear. And I'm pulling up and back. Okay, perfect. And another ear. And perfect. So the findings are normal. Left ear is no cerumen obstruction, and membrane is pearly gray. No perflaccid, and the malleolus is observed, and right ear and the cone of light on 7 o'clock, and left ear 7 o'clock, and right ear is at 4 o'clock and 5 o'clock, and left ear is membrane is normal, no obstruction of the cerumen, and pearly gray the membrane, and a malleolus and part flaccid is observed. Then we go in and we proceed to checking her field of vision, and I'm gonna ask you to so I'm gonna show you my wiggling fingers, and you're gonna tell me when you can see it. So just close your eye, and I'm gonna come close, and I'm gonna start wiggling.
On the left?
Mm-hmm. Just tell me when you see it.
Now.
Okay, perfect. And now another eye.
Now?
Mm-hmm.
Now.
Perfect. Okay. And the visual fields is normal, and I'm going to check her cranial nerve 3 3, 4 and 6, and I'm gonna check her visual I'm gonna remember soon. So anyway, follow my so at first I'm gonna ask you to look far away.
Okay.
And then look here. So her eyes converge, and then I'm gonna take it and it's accommodate. And now please follow the we're gonna check 6 cardinal points of gaze, and please I'm gonna hold you, so just follow my direction. Okay, and it's normal, and no nystagmus observed. And now we're gonna perform Weber test, and we're gonna check sensorial hearing. So I'm gonna hit it and put it in your head. You will tell me where you hear it.
Yeah.
Both? Okay, perfect. Okay, and now ring test. I'm gonna put it here. You tell me, are you hear it?
Yes.
And now?
Yes.
Tell me when it's finished.
It's stopped.
Okay, perfect.
Okay. It's stopped.
And AC higher than BC, and it's normal. Now I'm going to check her. I'm gonna check your mouth, and I will ask you to open your mouth and say R. And we already checked it's a cranial nerve 9 and 10. Can you show me your tongue? And tongue is normal, and under the tongue is normal, and buccal mucosa is normal, dentures is normal, and soft and hard palate is normal. And next thing, we're gonna check the pulse. So I'm gonna check the pulse, and we palpate radial pulse, and it's regular. I'm gonna check. And it's 60. And now I'm gonna take our blood pressure. I need you to hold it this way. Thank you. Okay, 120 over 65. And another arm. Another arm. $125 over 60, so it's pretty good result. It's normal, and I'm observing her skin meanwhile, and it's warm, mobile, and good sugar. And now I'm gonna check on your. I'm gonna ask you to sit with your legs back, and I'm gonna observe her posterior chest and palpate. And no tenderness, no ear trapped, and we're gonna check the lungs. So I'm gonna auscultate. And can you breathe with open mouth? Perfect. And I'm gonna check the lung expansion. And can you do a big deep breath? Perfect. And it's moving equally. And I'm gonna do and it's diaphragm exertion, and just breathe. Okay. And it's approximately 4 centimeters. And I'm gonna auscultate the posterior lungs. Okay, and it's resonant, and on auscultation it's vesicular sounds all the way down. Now I'm gonna auscultate anterior chest. Breathe with the open mouth. Okay, perfect. And I'm checking her respiratory rate. Just breathe. Okay, perfect. Now I'm gonna ask you to we're gonna do a breast exam. So I'm just observe the shape of the breast is normal. I know the skin is normal. I know orange peel, and no dimpling. And I'm gonna ask you to so we actually have to do it when you stand. Sorry. Careful. Okay. So just do it. Put it together, your muscles like that. So I'm observing for the shape when she's doing her muscles, and the shape and no dimpling. And now I'm gonna ask you to put it. Checking her. I'm just checking anterior fold, posterior fold, and axillary fold, and humerus, proximal humerus, palpating, and posterior folds, and it's normal, no nodules. And I'm gonna ask you to elevate your arm just up. Okay, and now I'm gonna ask you to bend like that. I have to see that, and the shape is normal, no deviation. And can you sit down? We're gonna I need you to lay down. I'm gonna just lay down. Okay, just lay down. Perfect. And we palpating the breast, starting from sternum side and going down in 3 different type of pressure, high and light, deeper and deeper, and going in circular motions and checking here. And then we squeeze the nipple and looking for discharge, no discharge. And now I'm going to inspect another breast and touching in circulatory motion and different type, and going to and squeezing the nipple, no discharge. And we actually have to do it when she's putting the arm. So it's done when the arm is under her head. And another one, also another one, please. Okay, no any noodles, and everything is look healthy. And now we're gonna go and do her abdominal exam. And I'm looking at the abdomen is flat and the skin is normal, no any extra pulsation. And I'm going to auscultate the abdomen and look for bowel sounds. And we're starting here. And bowel sounds is normal. And I'm going to percuss. And it's tympanic sound, which is normal. And now I'm gonna do a light pressure. And now it's a deep pressure. No any tenderness, no guarding. And now I'm gonna tell her and try to palpate for liver. And can you just breathe? And we're using hooking technique, and we feel smooth liver on the right side. And we palpate and percuss the liver borders is 6 centimeters. And now I'm trying to palpate her spleen. Can you just make a deep breath? And spleen is not palpable, which is actually normal. And now I'm going to listen to her aorta, and it's no extra pulsation, and renal arteries and femoral arteries. And I'm just gonna palpate her gluteal arteries and posterior tibial arteries and dorsalis pedis, and everything is normal, 2+. And I'm palpating her carotid, and actually I'm palpating from one side, palpating from another side, and I'm gonna listen for broods with the help of the stethoscope. Perfect. And now I'm gonna estimate her, measure her jugular vein distension. I'm gonna elevate a little bit. Okay. So I'm gonna put it the collateral notch. And at first I'm looking at it and finding the pulsation and measuring, and it's 2 centimeters, which is normal. So since she's laying down, I'm just gonna do her range of motion of the hips. So it just I'm gonna do it, just lay down, and it's flexion, and it's in external rotation, and external rotation, and internal and internal rotation. Okay, perfect. And I'm gonna assess her heart. So first I'm going to palpate her pulmonic, aortic. First I'm inspecting and looking at any pulsation or any deviation or swellness, and everything is fine. And palpating aortic, pulmonic, air point, tricuspid point, mitral point, and I'm trying to find PMI, which is in between 5th rib and mid-clavicular line, and it's pulsating. It's 1.5 centimeter approximately, the radius. And now I'm gonna listen to her heart sounds, and I'm listening with the diaphragm. Listening with the bell, no breath, no breath. And now I'm gonna ask you to sit down. I'm gonna listen. And just hold your breath. You don't have to hold like just shout. And now if you can just a little bit bend, just don't fall. No brutes. And sounds are normal. S1 and S2 is audible. No S4 and S3 sound. No S2 splitting. And I'm gonna listen for, and no friction rub heard during the auscultation of the chest and heart, and no friction rub heard, not splenic, not liver friction around the liver. And as I said, sounds was normal, and abdomen sounds are tympanic. So now I'm going to proceed and do your assess your range of motion. So I'm gonna ask you, we're gonna check the neck, and at first I'm gonna ask you to stand. Can you stand a little bit closer here? Yeah. So basically, can you turn? Yeah. So we're looking at the spine, and we're looking at the cervical, and it's normal bend and concavity concave, and no tenderness, no tenderness in the cervical spine, no tenderness lumbar spine. And now I'm gonna ask you to look up, look down. Okay. Put your ear into your shoulder, and another, and it's lateral bending, and just look up to the left, yes, and to the right, and it's circulatory motion of the cervical joints. And now I'm gonna ask you to we're checking the shoulder, observing the shoulder, and it's normal, not swellness and no tenderness, and the coracoid process, no tenderness, and acromioclavicular joint is normal, no sensitivity. And I'm gonna ask you to put it up and down, up and flexion, extension. And now lateral internal flexion and external flexion. Put them behind. And now internal flexion and external flexion. Okay, can you with the lumbar lumbar spine, can you just bend like you're reaching the toes? And it's a flexion. Thank you. And if you can bend back as much as you can, extension. And if you can bend left thoracolumbar bending and right thoracolumbar bending. And now we're gonna, can you turn? And we're checking the elbow, we're checking ulnar notch, and the joint is normal. And they cannot see. Can you just stand over there because they don't see? Yeah. Okay. So and it's a flexion. No, just flex like this. Flex, extension, and rotation. It's supination and pronation and supination. And another one, same. It's a flexion, extension, pronation, and supination. And I'm checking her wrist. It's not swollen, and fingers is not swollen. And checking her return of the return of the capillary return, and it's less than 30 seconds. And can you just flex and extend, and then just inside, move inside, just inside and outside. Yeah. So now can you sit down and check the knees? Okay. And I'm checking, we check hips before, it was the, we check the hips. Now we're checking the knees. I'm just gonna, it's flexion, extension, flexion, extension, and with the heels, it's a flexion, it's dorsiflexion, and plantar flexion, and now inversion and eversion. And we're gonna check muscle strength. So I'm just gonna check. I'm just gonna. You have to move your limbs against my resistance. So I'm checking biceps, triceps, and I'm checking just delta, yep, and biceps, and again triceps and delta. Okay, and now I'm against my resistance. It's quadriceps, and lower extremity. Okay, and it's 5 out of 5, which is normal. The muscle strength. So now we're gonna check deep tendon reflexes, and we're checking biceps, and we're checking brachioradialis, just right here. Okay, and checking biceps and brachioradialis, and we're checking triceps, just hanging. Okay, and we produce some tendons motion, and I can see it. Perfect. And now patellar reflex, perfect and perfect. And now ocular reflex, if you can put one leg on another, perfect. and ocular reflex, and we're doing the can you just sit a little bit deeper so they will see Babin's too? So we're checking Babinski. I'm gonna strike from down to up. She actually don't have, she don't have reflex. So now we're gonna do, and it's called position also we have to, can you just turn, I'm gonna do, so it's we're checking for inflammation here, if there is any inflammation of tenderness in the kidney area, and I'm just gonna percuss, okay, and you will tell me. No pain, right? Okay, and it's CVA tenderness, no tenderness. Okay, thank you. So we now we're gonna go and proceed and check their some sensory feelings. So I'm gonna just close the eyes. Thank you. And I'm gonna, you feel it, right?
Yes.
And it's soft or sharp?
It's soft.
You
Soft.
feel?
Soft.
Soft?
Mhm.
Okay. And now we're gonna do the sharp or dark or soft?
Down. Much.
Dark. Okay. Okay, perfect. You feel it?
Yeah.
Okay. And now we're gonna do vibratory sensation, and I'm gonna do it on your finger, and you will tell me if you feel the vibration.
Yes.
Okay, perfect. And another one.
Yes.
Okay.
Yes. Yes.
Okay. And sensor, we checking position sense, and I'm gonna grab your finger, and you will tell me it's going up or down.
Up.
Perfect.
Down.
Perfect. New legs.
Up. Up.
Okay, perfect. And I'm gonna give you something on your arm, and you will tell me what is that.
It's like a pin.
Yes, perfect. And I'm gonna give you what is that?
Q-tip.
Perfect. And it was stereognosis. And I'm gonna write something on your arm, and you will tell me what is that.
Can you do it one more time? E.
3.
Oh, 3. Okay. It was like,
Okay.
alright.
And this was graphesthesia. And
1.
okay, perfect. And now I'm gonna ask you to stand and careful. Okay. And so I have to, no, just turn. And I also have to check alignment of the shoulders, and it's aligned, no any deviation, and it's symmetrical, the hip symmetrical and knees is symmetrical, and when she put her heels together. And now I'm gonna ask you to put your heels together and with your open eyes.
Mm-hmm.
And now, can you just come here? And now just, I'm standing, if you're gonna fall, I'm gonna hold you. So now you just have to close your eyes and just stand quietly. Okay, perfect. So she's not falling, and it was a Romberg test. And now I'm gonna ask you to put your hands behind you, and No, I'm in front of you, sorry. And I'm gonna do, it's okay, it's enough. And pronator drift. So just close your eyes, stand for a second. And I'm gonna apply pressure. Okay, and she returns, so no drift. Okay, can you sit down? And I have to check the legs for we're checking the legs for calves for edema, no edema, and in malleolus area no edema, and her arms no edema, and her face is no edema. And let me just think if I need to do something else. And I think that we're done. I just want to make sure we did everything. We did this. It's also, I have to mention that her anterior posterior diameter is 2, lateral diameter is 1 to 2. And we're done. Thank you so much for being my actress.